very and this effort has been led by Kaylin Ostrowski, who is the Director of Advancement at the Global Health Institute. Before that, she was at the Woodrow Wilson Institute doing lots of cool projects on global health, and she's got some really innovative, great activities happening, and this is one of them to really move the agenda forward on hemp, which is important both for global health and for sustainability. So I just want to say kudos to you, Kaylin, and hand it off to you.
Great. Well, thank you, Jonathan, so much for the introduction. And good morning, everyone. It is so wonderful to see all of you. On behalf of the University of Wisconsin-Madison's Global Health Institute, welcome to our special Global Health Tuesday session on industrializing hemp to advance the United Nations 17 Sustainable Development Goals. As Jonathan said, my name is Kaylin Ostrowski, and I have the good fortune of serving as GHI's Associate Director of Strategic Partnerships and Development, and have had the distinct privilege of leading our efforts to investigate hemp's capacity to improve our global health. Industrializing hemp is disrupting healthcare, agriculture, energy, banking, technology, and more. The nascent industrial hemp and marijuana industries are making a worldwide impact by advancing therapeutic applications for epilepsy, multiple sclerosis, chronic pain, PTSD, and more. The industry also provides solutions for climate change using hemp as an alternative crop for paper, textiles, plastics, construction materials, and other green technologies that rebuild biodiversity loss. As hemp unleashes a flood of potential, medical professionals are beginning to request more information and more training, as well as evidence-based research to inform their patients' care. Farmers are looking for diversity of crops, access to genetics, and new ways of agriculture to combat climate change and feed the future. Governments are looking for ways to curb the carbon footprint while increasing GDP, and the industry's early stage affords a truly unique opportunity to collaborate across sectors, share lessons learned, improve infrastructure, and equip a new generation of leaders. As we prepare to discuss the versatility of the ancient and sacred cannabis plant that comes from the land, let's take a moment to first reflect upon the land where we find ourselves living and working today. The University of Wisconsin-Madison is occupied on ancestral Ho-Chunk land, a place called Des Jopes since time immemorial. An 1832 treaty forced the Ho-Chunk to cede this territory, and the people of that sovereign nation faced decades of ethnic cleansing and forced removal. The state of Wisconsin and the university were established here 16 years later. UW-Madison's Our Shared Future marker asks us to consider our shared past, present, and future with Indigenous peoples. We celebrate and recognize today's vibrant culture and the ongoing contributions of the Ho-Chunk Nation and all of Wisconsin's 12 Native nations. Let us remember these nations, the ancestors, with their Indigenous wisdom and scientific knowledge, who were and continue to be stewards of the places where we live and work. Today's discussion and investigative research is generously sponsored by the Ira and Aneva Riley Baldwin Wisconsin Idea Endowment. The Wisconsin Idea is the ethos that research, education, and practice-based knowledge generated here at UW benefits the people of Wisconsin, the nation, and the world. Founded upon the Wisconsin Idea in 2011 and born out of the Center for Global Health, GHI serves as a hub for global health education, research, and outreach. We work across 21 schools, colleges, and divisions at UW. And today, more than ever, we serve as an exemplary model for education excellence, respectful collaboration, and evidence-based research. Here at GHI, we are committed to advancing equitable and sustainable health across Wisconsin and the world. We believe the health of humans and the planet are inextricably linked, and we work within and across disciplines to advance health today and ensure well-being for the future. We are guided by a diverse group of multidisciplinary leaders, and our campus-wide approach enables us to build a groundwork of cooperation and break down silos between disciplines. Today's event would not be possible without the generous support of project partners whose expertise and innovation and innovative work across disciplines, coupled with research drawn from academic and industry literature review, help to inform the final report being launched today. So I want to give a huge shout out and thank you, my deepest gratitude to these 14 partners who all said yes when we approached them about this topic. I'm truly humbled by the breadth and depth of this group's expertise, their generosity and willingness to collaborate, share lessons learned, and develop new opportunities for unleashing hemp's full potential. I look forward to introducing them further and hearing their insights during our panel discussion. And I'd also like to take this time to thank GHI Research Assistant Noah Cook for his incredible efforts identifying targets related to hemp and support over the last year. So, what is the status of hemp in Wisconsin and legalization across the world? What are the United Nations SDGs and how do they relate to hemp? Hemp is a variety of the cannabis sativa species, and it is a plant grown specifically for its industrial usages and dates back to 2800 BCE in Central Asia. When one hears or thinks of hemp, they commonly associate it with the psychoactive cannabinoid that is responsible for the psychoactive effects in marijuana, and often fail to make the distinction between hemp and marijuana. Although both are derived from the cannabis sativa plant, in order to be considered hemp, the plant must contain less than 0.3% of THC, compared to marijuana, which is defined by the government's Controlled Substances Act as cannabis that exceeds 0.3% THC. And in 1937, the Marijuana Tax Act placed a tax on anyone who dealt commercially in hemp or marijuana, ultimately destroying the legal cannabis industry. But before Prohibition in 1937, Wisconsin led the nation's hemp production, meeting demand for rope, clothing, shoes, and more for those serving in the military during World War II. In 2018, the United States federally legalized industrial hemp, and Wisconsin reignited its hemp program, experiencing a six-fold increase in both grower and processor applications during its second year. Beyond hemp, 39 states have legalized medical marijuana and 19 allow for consumption of its recreational usages. Neighboring Midwestern states to Wisconsin including Illinois, Minnesota, and Michigan, have legalized production of marijuana for its medicinal and or recreational usages. As you'll hear today, policymakers, health practitioners, and researchers in Wisconsin are responding with new programs and opportunities to make Wisconsin a pioneer in this space again. Here at Wisconsin, UW now leads the state in working with a multidisciplinary team of scientists and extension agents to create a foundation of best practices for industrial hemp in Wisconsin. And just this spring, UW hosted a 4-part Hemp by Hand webinar and workshop series where campus and community members had an opportunity to learn firsthand about industrial hemp and then come and work and touch, feel, and process hemp into paper, concrete, and textiles. UW-Madison School of Pharmacy requires candidates pursuing a master's degree to complete coursework in safe and effective use of cannabinoid-containing treatments, which is the first of its kind for pharmacy programs worldwide. And during the fall of 2020, UW-Platteville rolled out the state's first certificate program in the business of cannabis, cannabis law and policy, and cannabis healthcare and medicine. Other top research institutions such as Yale, California, Berkeley, Cornell, and the University of Maryland have all created cannabis research centers and offered training across medicine, business, and agriculture. Momentum for marijuana legalization is growing worldwide. In 2020, the United Nations approved the WHO's recommendation to reclassify marijuana from the list of most dangerous drugs and allow marijuana for medical purposes. And in 2021, the UN Drug Market Report placed a special emphasis on cannabis trends, recognizing that jurisdictions across the UN are moving towards reform. And last month, a historical meeting I had the good fortune of participating in took place at the United Nations in New York, where policymakers across the world convened with cannabis industry experts and hemp across medicine, agriculture, equity, and more to highlight the plant's unique properties for propelling the SDGs in local to global markets. So what are the SDGs? The SDGs, the United Nations 17 Sustainable Development Goals, are 17 interconnected goals to end poverty, advance health, education, reduce inequities, protect the environment, and accelerate economic growth through 2030. They are agreed upon, these goals are agreed upon by all 193 member states of the UN, and the SDGs include 169 associated targets, as well as a set of global indicators designed to shape national, state, and local government priorities and partnerships. Sustainable development is defined as a balanced approach to growth, meeting the needs of today's generation without compromising future generational needs. Cross-cutting and interdisciplinary, many of the SDG sub-targets repeat across goals, recognizing complex issues like health, equity, and climate change require collaborative solutions from many different stakeholders. During a divisive political climate, the SDGs remain favorable across the world and offer a blueprint for catalyzing local assets to make global change. Used in a variety of ways and by different sectors of society, the SDGs are increasingly integrated into business plans of Fortune 500 corporations and universities, as well as non-governmental stakeholders. So, turning things over, our research applied an SDG 360 analysis method to understand hemp's full versatility and its interconnections. This analytical framework is one of 5 ways to use the SDGs for applied systems thinking. And my colleague and project champion, Lori Dupree-Brown, Director of Human Health and Ecology and Distinguished Teaching Faculty of Civil Society and Community Studies at the School of Human Ecology, will briefly describe the 5 methods that we use, and one of which we used for this research. So, Lori, I will hand things over to you.
Thank you, Kaylin, and congratulations on all you've done. It was wonderful to be part of this project, really through our students. Noah Cook was a student in my class where we cover the SDGs and the students do an SDG 360 project. And thanks to Kaylin's being a great mentor and her extensive experience in the past, I think Noah had one of the best experiences of all the global health students this year. So thank you, Kaylin. I'm going to share a little bit about the 5 ways because we are applying this to a lot of problems. It echoes systems thinking, and I think it will help you to, as you're percolating what next, I think it would be useful to you. So here we go, and tell me, I'm getting into the full screen mode here. Great. So I'm starting with this image of some big words and big ideas because these are the UN values that undergird the Sustainable Development Goals. And we get so focused on goals that sometimes we forget to say equality, freedom, hope, peace, rule of law. And yet really these big ideas are what we're trying to achieve with the SDGs. I don't like to have clickbait without satisfying your curiosity immediately. So I'm going to start with what are the 5 ways. The first way is when you're talking about the SDGs, probably don't tell people about the UN far away. Don't talk about Geneva. Talk about local places and why it matters for them. So explaining the SDGs with local examples here in Wisconsin to establish relevance, urgency, consensus, and in the case of hemp, opportunity is a really great way to move forward. And Kaylin, you are and probably everyone here, but Kaylin, you're a great example of that. The second thing that you can do is crosswalk plans. Here it says city plans because most of this work has been developed with the University Alliance and other project that I'm involved with, and we work with cities. However, businesses, NGOs, civil society movements can crosswalk their plans with the SDGs, and that helps you to create momentum and show people that they're already doing things. So it really helps to move forward. It's not something new. It's making something that's already there clear and creating opportunities to do more. The third one is assisting with voluntary local reporting. And that is a national movement you can learn about that is focused on governance in cities. I'll share one slide about that. And then this SDG 360 analysis, which is what Kaylin and Noah have done. And it's a really great way to think about systems thinking tools, but instead of the goals being non-specific, the goals are the SDGs. And you're taking your work and putting it right at the center. And then centering equity inclusion is essential. I always think it should be first or last. The reason I say it last is because you can really make connections with the things that have come before. So that's why I chose last instead of first there. So one big idea that I think is important to underscore is that sustainable development is not only about sustainability. It really never was. Sustainable development was always about meeting the holistic needs, the 3 E's, right? Economic, environment, and equity, without compromising the future. And so here I'm looking at 1987, that definition still operative, but as we've moved through the MDGs and all the different policy efforts, the SDGs are sometimes visualized as a wedding cake. So look at that wedding cake on the right. The big important part is this biosphere, right? And the fundamental foundation of then society and the economy and governance. So that's a really a nice way to think about this wheel that allows you to do good work, whether you call it eco health or planetary health or One Health or global health, or going beyond using the word health and well-being. This framework is incredibly powerful. So just to show you one picture of each of the 5 ways, telling local stories. Here's an example. People can think clean water, that's not about us. Well, talk to the residents of Flint. And there you see SDG 6 used as a tag in this local emergency. Crosswalking with city plans, that can be local. And here's the city of Madison did a crosswalk of their plan. Their plan does not mention the SDGs. So that's not a great way to start saying, oh, you didn't even mention it. Instead, we said, look at all the ways that the SDG indicators were reflected in your plan. And so it becomes an affirming asset-based way to begin work. And this is really helpful with corporate players as well, because their strategic plans may not explicitly mention it, but if you do something like this, it's much easier to get momentum. The voluntary local reporting is something that cities do, and you can look for examples here. There's probably maybe 10 or 15 cities in the US that are doing that. And there's a great organization called the Sustainable Development Solutions Network that produces data that makes it really easy to get on the train, both at the state level and at the city level and national. So this is something that can be done at the state level as well, that could be done in Wisconsin at the state level. It is not difficult to do. I will have a project team for you. In fact, I have a team looking for a project this summer for their 8-week global health course. This is the SDG 360 analysis, and I am going to show 2 examples really quickly. It takes those tags that are so powerful for clear communication and uses that as a wheel for integral analysis. So it's not tags or wheels, it's both, right? And often you will start with simply tagging. But when you do this kind of full circle analysis, you identify co-benefits that makes it easier to advance what you're doing. That's very important with hemp. All the misunderstandings about hemp can be aided by this benefits analysis. And Kaylin already did a great, beautiful job of that when she told the history of hemp in the introduction. The other thing is you can error proof. You can find unintended harms and you can eliminate them before you do your first cycle of implementation. And that builds confidence in your partners that you're thinking, you figured something out, you anticipated a problem. And then important for governance and democracy is making trade-off explicit. A lot of times when we say win-win, we mean net win. That means overall, it's good. But how do we make sure that there aren't subpopulations that are disadvantaged? And how do we address that and do the reparations that we need to do so that it really is truly fair? That's digging in, and you can, this wheel can help you do that. And so it's a reason to be optimist, and it gives you more face validity with suspicious, people who might be rightly suspicious of this new effort. So here's two examples of some SDG 360 analyses. You're going to see my best and favorite in a minute when Kaylin and Noah show what they did. But this is centering urban health and linking it to all those indicators, centering cities. This is an emergent tool to do this kind of integral thinking with the SDGs. Regarding equity inclusion, there's a number of tools that we've developed that we can really dig into. And SDG 5 and SDG 10 are two, but there's some additional things that I do working in a US context, because the way race and gender are talked about in the US is different, and appropriately so. And so there are some, additional things you can do. So with that, that's the 5 ways. I hope you do them all. And we are in the process of adapting this approach for Latin America, and the China version is almost ready to go, and an Africa version as well. So people can be running around in circles in the good way all around the world soon, I hope. Thank you very much.
Excellent. Thank you so much, Lori, for your leadership in SDG analysis and demonstrating to the university and to our students and teaching them how to think about complex issues and breaking them down and using the SDGs as a method to help us better understand those very complex interconnected issues. So as Lori shared, we used the SDG 360 analysis method to better understand hemp's interconnections. And the stepwise process really helps to optimize impact and establish the broadest possible base for support. So to begin our 360-degree evaluation, we anchored hemp into the middle of this wheel and began by identifying a cluster of 4 SDGs most critical to GHI's mission and vision. And so we identified SDG 3, SDG 9, SDG 13, and 15 as the areas that were the most aligned with GHI to start. And so we identified within their sub-targets, based on conversations, based on our literature review, how good health relates to hemp. And so we found various research that demonstrated the types of things that hemp can advance. For example, there is evidence that biodiversity can be improved for bee populations through hemp. And so when we centered hemp into the middle of the wheel, we used the original 4 clusters to then dig into the sub-targets and then follow those across the different SDGs, which led to a full sweep of all 17 goals and all 169 targets that then resulted into the 54 targets that you see here on this slide. These are 54 unique entry points for unlocking hemp's full potential. So for example, the 360 process illustrated hemp as a regenerative crop, building organic matter and restoring degraded soil, which supports SDG 15.3, which is restore degraded soil and land. Strains of hemp are bred specifically for phytoremediation, which is the use of plants to remove pollutants from soil, water, or air, which advances SDG 6.3. The 360 process also uncovered, as Lori mentioned, it helps to uncover trade-offs as well as unintended consequences. And we learned that hemp industrialization has the ability to, as I mentioned, absorb toxic metals, but it also therefore makes it dangerous for consumers who ingest it. This trade-off can be addressed through SDG 2.5, maintaining genetic diversity of seeds that are not bred for phytoremediation. And hemp can be cultivated in practically every environment without artificial fertilizer and less than 1/3 of water needed to produce cotton. Local cultivation and processing results in less exportation emissions, and hemp's lightweight material lessens its carbon footprint during transportation. Industrializing hemp has many downstream benefits on the supply chain, catalyzing local cultivation, shortening distances between producers, and igniting rural economies, thereby influencing many sub-targets in SDGs 6, 10, 11, 12, 14, and 15, to name a few. This figure takes the wheel that you saw on the previous slide and describes what each of those sub-targets is. So for example, from jobs to tax revenue to commercial and agriculture real estate, hemp industrialization has a large and growing impact on our broader economy. SDG 10, Reduced Inequities, creates a powerful framework for mobilizing resources and developing hemp's infrastructure to advance equality. Targets identified in SDG 10, such as 10.1, improve or income growth, 10.2, social, economic, and political inclusion, and SDG 10.3 and 10.4 provide guidelines for catalyzing hemp's capacity to bridge equity gaps and integrate holistic solutions in policies, plans, and multi-sectoral collaboration. As hemp thrives in many types of soil and environmental conditions, it is a viable crop around the world, igniting new jobs and innovation while simultaneously improving food, gender, and health inequities. Access to land, SDG 2.3, maintaining genetic seed diversity and equitable sharing of resources, SDG 2.5, investing in rural agriculture, 2.A, correcting restrictive trade policies, SDG 2.5, and gender equity, 5.1, are also unique pathways for utilizing hemp to advance positive change. SDG 17, Partnerships for the Goals, provides a roadmap for unleashing hemp's potential and calls for policy cohesion, multi-stakeholder partnership, and effective public-private partner and civil society partnerships. So this slide is what we're going to be able to review today is very limited. We don't have a lot of time, but I encourage you when the report is released later today to please dig in and follow along. You can see the 54 targets and how that really serves as a unique pathway of how this plant and its full versatility can truly advance all 17 United Nations SDGs and provide pathways for new collaborations. So our goal for this research was to do the sweep of the SDGs and identify where and map where hemp falls along the SDG wheel, and to create recommendations for UW and as well as the industry. So our goal and our recommendations to the university are to continue this momentum through GHI and establish a multidisciplinary think tank to increase awareness, exchange knowledge, identify synergies, and close gaps. And a lot of these recommendations came from our panelists and through our research and one-on-one conversations with folks around UW. Developing a series of educational webinars for Wisconsin and global policymakers to improve the understanding of the endocannabinoid system, which Natalie can maybe talk a little bit more shortly about what that is. So putting together educational workshops for policymakers and business leaders and everyone really to be able to better understand how the plant interacts with the body and what actually hemp's capacity is to advance the SDGs. Really helps to demystify and take negative perceptions away that currently exist around the plant. Authoring multidisciplinary grant proposals is on the docket. We're working with campus and non-campus partners to continue to create strategic alliances. Creating partnerships with other universities, leading hemp and marijuana research, hosting scholarly exchanges with universities in different growing conditions and legal regulations so that we might share lessons and share genetics, best practices. The UW School of Pharmacy is leading the curriculum on the endocannabinoid system. We need additional research to better understand what is the available curriculum on hemp and marijuana across universities and in medical schools. And then we want to increase campus and community understanding of hemp products and processes through public engagement workshops like the Hemp by Hand series. We want to make sure that we get the School of Engineering involved. We know through our literature and through the industry that the infrastructure is not currently available to really scale hemp for creating a green economy through hemp. And so working with the College of Engineering and others to really retrofit hemp's infrastructure. And then identifying and advancing synergies. There's a hemp research consortium that just began with land-grant universities. As a land-grant university, I'd really like to see UW at the table. Continuing to attend events at the United Nations and raise visibility of the SDG targets associated with hemp. And partner with the UW Integrative Health Clinic to continue to educate and advance medical professionals' knowledge, as well as patient knowledge, and incorporate lessons learned into medical visits for things like chronic pain and insomnia. So, but these are not all of the recommendations, and they're certainly not all of the targets. I'm sure that, we may have missed, but the 54 are what we came up with. And so, in the spirit of SDG 17, multi-stakeholder partnerships, I'd now like to turn it over to our panel discussion and ask our panelists, we'll go in alphabetical order, to just briefly introduce themselves. So Dr. Bola, we'll start with you. Then we'll go to Steve, D'Angelo, Shelby, Dr. Kiefer, Brian, and then Natalie will go that way. So if you could, unmute yourselves, just quickly introduce yourself. What is your relationship to hemp? And then we'll dive into a deeper, larger group dialogue. So Dr. Bola.
Thank you very much, Caroline. And congratulations again for coming this far. I'm Dr. Bola Ademilua. I'm the center leader for the African Center of Excellence for Drug Research, Herbal Medicine Development, and Regulatory Science in the University of Lagos, Nigeria. Our center is a World Bank supported center, and basically we work towards the achievement of SDG 3. So we are into medicine, and we're trying to develop plants into medicine. So for us, being in Nigeria, as you know, Nigeria has a all year weather, all year summer. So we grow every year. So for us, we have a large biodiversity. In terms of hemp, most common for us is cannabis than hemp, as is done in many countries. So joining this team is very crucial for us because we're interested in any medicine from plants that can help with non-communicable diseases. So when you relate to depression, pain, epilepsy, we are interested in all that. And that is the advantage of what the hemp provides through the high level of CBD versus the THC. So we're interested in that. And that is the reason why we are happy to be part of this network. Thank you.
Thank you, Bola. Steve, would you be willing to introduce yourself and share a little bit more about yourself?
Sure, I would, but I'm just recovering from COVID, so you're going to get the voice version, not the video version. My name's Steve D'Angelo. I guess I'm here really with a pioneer's perspective. I am a lifelong cannabis activist, entrepreneur, educator, and I first got interested in hemp in the mid-late 1980s when a friend of mine named Jack Herer wrote a book called The Emperor Wears No Clothes. And Jack was a brilliant guy, but not terribly well organized. And so he came to me to help me help him edit the book and publicize it. And that really set me off on an odyssey, which has continued to this day. A few years after opening the first hemp museum and doing the first hemp tour of U.S. campuses, this was 1989, 1990. I started a company called Ecolution, which lasted for about a decade, and we imported hemp products. We manufactured hemp products in Eastern Europe, the Czech Republic, Romania, Hungary, and exported them to retail stores in 21 different countries. After that experience, I started getting more interested in medical cannabis and spent a number of years helping build out the legal medical cannabis industry. But hemp has always been a part of my thinking. And I guess what's really exciting to me about seeing the work that you're doing is that I have always believed, based on the amount of education I can do on myself, that it should be possible to build a new life-affirming green economy with hemp as the backbone of that economy. And now to see the actual work being done, the rolling up of the sleeves, the nitty-gritty of figuring out how that happens, and all the kinds of co-benefits that we're talking about here, and building of the infrastructure and all of the other challenges is just tremendously inspiring to me. And it's validating for, many activists who unfortunately are no longer with us today, but who really dreamed of a day when folks with your skill sets, your caliber, and your resources were able to focus on this question. So thank you so very much for this work. It's really inspiring. And I think that for me, it's really simple. This is the plant that's going to help us save the planet. And there's no more important work to be done today than the work that we're all doing together.
Well, thank you, Steve. If it weren't for you saying yes to a meeting with Jonathan and I back in early March of 2020, before the world really changed, we wouldn't be here today. So thank you so much for your support. Shelby, can you please share a little bit more about the incredible work you're doing here?
Sure. Thanks very much, Kaylin. And this has been very inspiring to hear everyone's stories and to hear about all of these SDGs. It's exciting thinking about my career moving forward. So I'm an assistant professor at UW-Madison studying hemp genetics and breeding. So I'm on more of the agricultural production side. And I've been working in this area for about the past 3 years. And really my goal when I started this position was to better understand what the needs were of the growers in our region. And if they were going to grow hemp, we need to make sure that we had good cultivars that performed well, that were high yielding, that would be able to make them a profit, so they'd be able to continue to work in this area. So we've been doing lots of cultivar trialing, and I also work with a lot of other institutions and farmers around the Midwest, and a lot of the work that we've done has helped inform future policy through USDA, kind of, that 0.3% THC number we always hear about. We're just trying to add more unbiased scientific evidence to what those numbers should be, what they mean, and then, trying to push forward cultivars that are good for each of these different areas. So that's something I still struggle with now is, do we breed hemp strictly for fiber production, strictly for phytoremediation, strictly for grain production, or do we try to breed cultivars that do all of those things kind of okay? So I really am eager to talk to others and hear what the needs are as we try to develop these specific genetics and cultivars, and even beyond the Midwest and Wisconsin, the Midwest, thinking about this even more globally about sharing genetic resources, because only after we kind of have this collective seed and germplasm available to share can we kind of solve some of these problems or bottlenecks that we have with creating superior hemp cultivars.
Wonderful. Thank you so much, Shelby. Dr. Kiefer.
Hey, everybody. I'm David Kiefer. I have a joint appointment in the medical school and in the family medicine department. It's a true honor to be a part of this group. It really is. The interdisciplinary wisdom and knowledge. It's just been great to learn what everybody's doing. I'm the director of the Integrative Health Clinic. We receive patients in this clinic. It's over at Research Park, one of the UW sites. Patients come from primary care offices and specialties from around the area and from Wisconsin for that matter. So really, a good example of the Wisconsin idea. We field a lot of questions about dietary supplements. Patients and clinicians are wondering about all kinds of things, especially CBD recently, about dose, safety, efficacy, quality. I could envision that this will include THC down the road when legislation changes. And I'm super interested in bringing all of your wisdom and knowledge from this group into the clinic, really just to help patients and clinicians learn about this topic.
Thank you, Dr. Kiefer. Brian, why don't you share a little bit more about what you've been up to?
Yes, yeah, good morning. Again, happy to be a part of this group and to participate in the conversation today and the earlier talks as well. I'm Brian Coon. I'm the director of the Plant Industry Bureau at the Wisconsin Department of Agriculture, Trade and Consumer Protection. So my involvement in hemp comes from a state regulatory and licensing perspective. So my agency drafted the original hemp rules in Wisconsin based on the 2018 Farm Bill, the federal legislation that allowed for hemp production in the United States. And that allowed, through that rule that came, again, we got legislation from the state legislature that pushed this forward. We wrote the rules around that to give growers a framework of how to get licensed and how we would follow, the regulatory requirements of federal law in Wisconsin. And one of the challenges that came for us and for growers in this whole process is that we updated that emergency rule multiple times over the 3-4 years that we ran this program in Wisconsin, the hemp regulatory program. So that, there's kind of been a constant evolution. It's been overall good, I think, but it's been continuous change for our growers on the production side, having to evolve and kind of pay very close attention to that changing regulatory environment. We operated and provided that regulatory oversight for the hemp production in Wisconsin from 2018 through 2021. And then back on January 1st of this year, to provide the greatest opportunity to our hemp growers, we transferred that program regulatory authority over to USDA. So in this case, USDA is running the exact same program that we were, but they aren't generally charging any participatory fees. So it reduced the kind of the fiscal entry point for growers into the hemp program. So now USDA is heading up the regulatory oversight for hemp growers in Wisconsin. Again, it is the identical program that we were operating from a regulatory standpoint. I think the other thing that's evolved is as well, DATCAP, my agency, was doing the sampling and testing of hemp production in the state. And again, that's now moved to the private sector. So I think, again, we've been on a rapid regulatory and kind of real world change and progression in hemp production in the last probably in the last 8 years, but in the 4 years that Wisconsin growers have been involved in actually producing hemp. There's been a lot of change and a lot of movement from a regulatory perspective. I think, what we've seen through Wisconsin's involvement and from an ag production standpoint is there's certainly interest in Wisconsin by Wisconsin growers and having a more diverse offering of crops that we could plant. Hemp is one of those that could do well in various agricultural settings as a crop that would be rotated in with other more standard crops. We've seen that given the opportunity, our growers are interested and our growers will grow it and can produce hemp very well. The challenge that we've seen in these years is that market side. And so that's one of the biggest challenges. And as we saw kind of I'd say almost a meteoric growth in interest in this crop, we've seen a significant tailing off of that because of that market reality. So that's one of the things that we really need to kind of work on and get figured out for the future for this to be a successful long-term crop in Wisconsin. But I think it's one that holds great potential, and now it's our challenge to capitalize on that. Thanks.
Thank you, Brian, so much. You've been such an incredible asset to our conversations. I've really enjoyed talking with you and look forward to continuing the dialogue. Natalie, can you please share a little bit more about what you're doing in hemp and cannabis?
Yeah, I would just like to echo first everyone's gratitude and excitement to be a part of this group. I'm Natalie, an assistant professor at the School of Pharmacy. Prior to coming to UW, I was a part-time medical cannabis pharmacist in Minnesota. So in Minnesota, you need to be in their medical program, you need to be a pharmacist to dispense cannabis. So that's where some of my clinical experience came from, but also recognizing a lot of the gaps in knowledge. So that's one of the things I'm working on addressing here at UW is better understanding the therapeutic applications for some of these different cannabinoids, particularly for cancer supportive care, along with some other conditions as well. And then the other side of my effort here at UW is education, of course. So we have a elective that we've developed in endocannabinoids and cannabinoid pharmacology and therapeutics. And that's for both master's students. It's a required component of one of our master's programs, and it's elective for our pharmacy students. And we've also worked on integrating some lectures on the endocannabinoid system and the pharmacology and therapeutics of cannabinoids into our required curriculum for the pharmacy students. Additionally, doing some continuing education work for our practicing pharmacists in Wisconsin. So trying to capture both practicing pharmacists and the next generation of pharmacists, because they're so accessible to our patients, and helping to educate them will provide multiple benefits for patients that are interested in using these products.
Thank you, Natalie, and congratulations on your success leading that here at UW. It's so critical. This work has really demonstrated the need for academia to really ramp up its efforts in research and outreach. And I really appreciate all of your work that you're doing. I've learned a lot. Isaiah, would you mind introducing yourself and sharing a little bit about what your office has been involved in with this project?
Sure. So my name is Isaiah Benamy. I am Representative Stubbs' Chief of Staff. Representative Stubbs represents the south and west parts of Madison, including part of the UW-Madison campus, as well as the Goodman South campus and Edgewood College. We are incredibly proud to be a part of this and to learn about all the potential and all of the great ways that we're able to make this plant not only benefit us economically, but also through healthcare and all of the various ways that are possible. We are proud to be a leader in informed and progressive policies around this in order to foster the potential that is truly there. Representative Stubbs is a former probation and parole officer, and we sit on the Committee on Criminal Justice and Public Safety, as well as the Committee on Corrections. One thing that cannot be ignored is what prohibition has done as far as racial disparities and mass incarceration, and seeing that not only would we be able to move a policy direction away from there, but also turning it into a net benefit from this plant. It's not only something that is locking people away, but this is something that people are going to be able to make a living off of, able to support our economy, able to support our healthcare system. And so it's truly great to be a part of this work and to see all of the studies that are being done. And we are happy to be a part of it.
Thank you, Isaiah, and thank you for your team's participation. When we had a chance to meet earlier this year, it was really your office that, when we shared the analysis of the 54 sub-targets that we found, that said, this is something that all policymakers here in Wisconsin and nationally and globally need to see, and that this, there's quite a bit of it pitting against parties, but actually when you look at it, there's quite a bit of agreement on the need for legalization. We're talking about hemp specifically right now, which is fully legal. But when you come to demystifying the plant, that these 54 targets can help drive those conversations and bring people from different sides of the aisle together around economic development, health, and equity. So thank you everyone for your introductions. I'm just gonna throw out a couple of questions and please chime in. So I'm curious, there's such a diverse group of individuals that have been a part of this project, and obviously that, hemp touches so many things. Who would be willing to share, how did this SDG 360 analysis of hemp help you identify co-benefits in your areas or help you find new trade-offs that you wouldn't have thought of otherwise? And then also, how do you envision these 54 related targets informing your work moving forward? What additional research is needed, outreach, collaboration? Who would like to share first? Bola.
Thank you, Kellen. For us, like I said, our center is interested in SDG 3, but with the time we've interacted on this network, we begin to see ourselves as being a bit selfish, being one-sided, because the 360 has allowed us to see that whilst we're talking about trying to get active ingredients, active compounds from the hemp for medicine, we could also be looking at it in terms of the use of other parts of that hemp, which could assist those in agriculture in terms of the income generated from planting. And then another thing about Nigeria, if you must remember, is that we've got some polluted land mass in the South Nigeria, and learning that the hemp could be used in reclamation of this polluted land is a very big plus for us. It's something, like I said at the beginning of this platform, that the cultivation of hemp in Nigeria might require a lot of government interference. So bringing in other SDGs that could benefit beyond what our interest is a huge plus for us in terms of pushing the advocacy for the cultivation of hemp versus cultivation of cannabis in Nigeria. So I think the 360 has allowed us to open our horizon further to consider other areas of human life that could benefit from the plant aside from medicine. Thank you.
Thank you, Dr. Bola. Other esteemed panelists? How are the 54 SDGs? How is that going to inform your work moving forward? And again, any aha moments that you were identifying through the SDG 360 analysis of co-benefits or trade-offs that you were surprised by, or we talked about recommendations. How do you feel about those? What do you think is missing? And where do you see opportunities for growth in your areas?
I hate to cut anybody else off, but I could jump in. Yeah, lots of aha moments. I think about going forward and how important the transdisciplinary work is. I want to take Natalie's course.
I think we should all take Natalie's course. Every discipline.
Every discipline. And recently, the Family Medicine Department changed its name to the Department of Family Medicine and Community Health. So the idea of weaving in Lori's work and her use of the SDGs into community engagement, community health, I think that seems really interesting to me, and how the clinicians that I work with could get involved with that. And on that note, what I didn't think of before as much as I should probably is how important it is for clinicians in our one-on-one patient work to still think about how important it is to get out of the clinic into the community, travel abroad, work on a global level. And I've been involved with global health mostly in Latin America for years, but just that needs to be a constant reminder. And then the other thing is that I think we probably have a tendency, just because of how overwhelming all the information is in the practice of clinical medicine, it's a challenge to stay up to date. And just listening to this group and delving into this topic, I realized that the science is evolving quickly, and it's going to take a constant effort to stay on top of what's the latest data and which diagnoses respond best to the cannabinoids. And so I think that's another aha moment, is keeping the communication open so that we're all up to date.
Thank you, Dr. Kiefer. I know when we met as a group back in March, one of the aha moments for some of us was, Shelby, hearing about all the work that you're doing with farmers and around Wisconsin, and hearing about not only the need for genetics, but then the access to market, and really the need for infrastructure support. So I'm wondering, we've talked a lot about who's missing from the discussions and folks like the College of Engineering. Can you talk a little bit more about your research and the survey that you recently completed with farmers around the country, and what they shared about what they need to in order to scale?
Yeah, sure. It's really interesting because, as Brian said, we can actually grow hemp fairly well in Wisconsin, and there are cultivars that perform pretty well and they're high yielding and it's great. But the reason why we don't have the same number of hemp farmers this year is because people could not sell that hemp. So the question is why, right? There's lots of products that can be made and people are very excited about them. And we talk about using it as a potential medicine. But so there's this disconnect right now. And we talk about this word infrastructure all the time, but especially when it comes to, hemp for fiber production, or these new products that really are being researched at the same time as we're trying to produce them. So it's this whole thing where we grow a bunch of hemp, we have a bunch of hemp that we could potentially use to convert into these products. We don't have the best way of doing that yet. So everything that I have learned in the past couple of years is that I always say this because I used to work in carrots. It's not just like growing a carrot and eating a carrot. Like there's so many different people that need to be involved in a crop like hemp, from the regulatory side to the engineering side to processing this. The education side is huge. I forget now that people don't know the difference between hemp and marijuana, because I say it in my sleep every night what the difference is, but so many people don't know that. And so it's really important to continue educating people and then every time people learn more about hemp, they're super excited. They want to learn more about the products. So then hopefully that can help with the marketing. And, the survey was like, what do we need to do in hemp? And the survey was, everyone said everything. Like everything needs to be done, from understanding the regulatory side to growing it, the best agronomic practices, the infrastructure, the economics. Every single thing needs additional support. So I think only through kind of these broader networks, not only at UW-Madison, not only within Wisconsin, not only within the United States, but globally. I mean, people have been growing hemp all over the world this whole time that we have not been doing it in the United States, right? So there's a lot of lessons to be learned. So just building these networks, because yes, that entire continuum from seed to product needs lots of people to help it if it's going to be successful. And successful means people are going to grow it profitably. Otherwise, it won't exist, right? So that's my 2 cents.
Well, we appreciate
I would echo that. I think that the challenge in building a viable hemp market is one of infrastructure and really getting the infrastructure you need for the entire market. So I'll just give you one example of some of the challenges that we face because our infrastructure has been geared towards other products. Right now, you could probably you can certainly grow hemp for textiles, but there's a critical bottleneck, right? If you want to create hemp textiles right now, you need to have a spinnery, right? A spinnery that can spin long bast fiber. Well, there are no long bast fiber spinneries in the United States of America because all of our spinneries are geared towards cotton, which is a very, very short fiber. And so in order to have a viable textile industry, you need to have long bast fiber spinneries co-located to large amounts of cannabis production so that your profit margin isn't eaten up in your transport costs. So typically, when you're creating a new industry like this, and we're really talking about shifting the raw material basis of our entire industry, it does take the kind of effort that all of you are putting together. And what I would urge you to do is, See if you can identify places along the industrial supply chain and infrastructure that are more ready. So one example is there's lots and lots of rolling plastic mills and extrusion mills in the US. If someone could develop a hemp polymer that could be pelletized and used in those same mills, you could create a huge range of hemp plastic products with the existing plastic manufacturing infrastructure in the United States. So zeroing in on things like developing that hemp polymer and pelletizing it, identifying the areas. I think hempcrete also offers other potentials. So there are certain sectors of the economy where I think you can take on a shorter part of the infrastructure and have impact and then build out from there.
Wonderful. Thank you so much, Steve. Well, we are 3 minutes past our hour. I know I could sit and talk to you all about this all day long. So I want to thank all of you so much for being here this morning, to all of our panelists, to all of our project partners. Again, we truly could not be having this conversation without you. I really look forward to continuing the dialogue, to following up on our recommendations, to moving the needle, to scale research, scale infrastructure, improve our human health and our animal health, our planet's health. And stay tuned. Keep your eye on your inbox. The report will be released very soon, along with an archived link to this video. This event today was part of our Global Health Tuesday seminar series, which takes place each month. And so we'd love to see you again on July 26th for a discussion with Associate Professor Sean Chauvel from the Department of Entomology, talking very timely for the summer. He's going to discuss population divergence and local adaptation of black-legged ticks in the United States. So again, thank you all so much. I really enjoyed this conversation. If you have thoughts and feedback, additional recommendations after you get the paper, after you think about what you've heard today, please do not hesitate to reach out to any of us that are part of the project. We are very collaborative. We want to partner and we want to move this forward. So thank you all. Have a great day and be well. Take care.
Thanks, Kaylin. Wonderful
Thank
panel.
you.
Thanks, Kellen.